Enable desk. Video is going to start now. GH. A migraine is more than a headache. Migraine is the third most prevalent illness and the sixth most disabling globally. More than 90% of people can't work or function during attacks. They impact more than 4 million Americans chronically, which is 15 or more a month. Women are especially impacted by migraine. 3 times as many women than men experience migraine. 85% of chronic migraine warriors are women. 25% of women overall experience migraines. Although it is well known in the medical community that migraines are actually a type of neurological disease, it seems that they still continue to be dismissed both by medical systems and those that do not experience chronic migraines. This disease can cause long-lasting brain damage and is related to increased risks of stroke and aneurysms. Further, they can cause memory loss and brain fog, both of which can be debilitating symptoms. Migraine symptoms may last 4 to 72 hours. They include severe throbbing head pain, inability to concentrate, vision changes, fatigue, nausea, light, sound, smell, and movement sensitivity, vomiting, memory loss, numbness, slurred speech, dizziness, and aura. There are 7 subtypes of migraine, including without aura, which is most common, without headache, with aura, known as classic or complicated migraine, hemiplegic, retinal, chronic, brainstem aura or bacilla type. Migraine without aura can be experienced for up to 72 hours. 85% of people experiencing migraines have this type. Symptoms may include fatigue, pain on one or both sides of head, nausea, vomiting, sound and light sensitivity, depression and anxiety. Aura is very commonly experienced by those with migraines. It can be kind of scary at times and is rarely associated with tingling or numbness of the extremities. The aura itself should only last from 5 to 60 minutes. It typically precedes head pain. It may include symptoms such as vision changes in both eyes, flashes of light, scintillations, complete or partial loss of vision, zigzag lines floating across vision, shimmering spots / stars, scotomer, blind spot, flashes of light. A hemiplegic migraine is a rare type that is often genetic. It causes stroke-like symptoms such as paralysis on one side of the body, increased blood pressure, and pain on one or both sides of the head. Symptoms can last for several days or weeks. It is also associated with speech difficulties, confusion, vision problems, pins and needles, weakness, and light and sound sensitivity. Hemiplegic migraines can cause permanent brain damage. Retinal migraines occur only in one eye and are often accompanied by a headache within an hour. They are often confused with ocular migraines. However, they are a type of ocular migraine. The more common ocular migraine is the migraine with aura. These often last for 5 to 60 minutes. They are triggered by staring at screens, fluorescent lighting, and driving. Some vision changes in one eye include flashes of light known as scintillations, complete vision loss for 50% of people, blurred vision for 20% of people, scotomer or blind spot, which occurs for 13% of people, partial vision loss, which occurs for 12% of people, or dimming of vision, which occurs for 7% of people. Finally, there is a brainstem aura type of migraine, which may also be called a bacilla migraine. These are very rare types of migraines, and symptoms include vertigo, dizziness, disorientation, double vision, loss of balance, speech changes, vision changes, confusion, tinnitus, fainting. Migraine treatment can be varied, but most often it includes medications such as toparmax, amitriptyline, Aimovig, Emgality, Ajovy, propanol, Botox, nortriptyline, and antihistamines. The migraine cocktail is an IV given to patients at the hospital and includes 30 mg Toradol, 25 mg Benadryl, and 10 mg Toradol. One can request ibuprofen instead of Toradol. Other treatments include vitamins such as 300 mg CoQ10 and 200 mg B2 daily. Tinted glasses or apps to dim blue light. Some underlying conditions that are associated to migraine include mast cell activation syndrome, postural orthostatic tachycardia syndrome, ehlers-danlos syndrome, cerebral spinal fluid leak, cervicocranial instability, Chiari malformation, polycystic ovarian syndrome, and endometriosis. Thank you for watching. If you're interested in future videos, please click the subscribe button.